All right, welcome everyone, and thank you for coming on Saturday morning. As Dr. Masaki said, I'm really a loyalist for JABSOM. I went to medical school here, so even though this was the 60th reunion, I hate to admit it, but this past year was my 50th reunion from medical school, or 40th, sorry, from medical school, sorry. But my family and I owe a lot to this medical school. It gave us an opportunity to be a part of this healthcare community. And so one of the things for us that's always been important is to give back to the medical school, because I think what a lot of people don't realize is we have a physician shortage in Hawaii, but without JABSOM, that shortage would be almost unsustainable for us. And so it's really important to have this medical school here in Hawaii. It's for Hawaii, by Hawaii, and it's really about providing healthcare for Hawaii. So I'll get off my soapbox on that, but just so you know, I'm a definite loyalist to the medical school. So I appreciate the introduction from Dr. Masaki. I'm going to talk a little bit about my journey, how I got to HMSA, and all the cartoons. I wish I saw those before I decided to work at HMSA, because I might have actually done something different. But then we'll talk about Medicare. The one thing I will tell you is that Medicare is extremely complicated. And as a provider for all those years, not just here, but on the mainland, when I decided to retire, I thought, oh, I'll just sign up for Medicare. And little did I know that that was probably going to be one of the most difficult things I will ever have had to do in my medical career. I actually couldn't find resources to help bring clarity for me about what to do, which is why Dr. Masaki and I were talking earlier. So I was a surgeon. I ran the Department of Surgery. I ran the residency training program. So you would think, boy, there couldn't be a job harder than that. And then when you throw on, I was chief of surgery at Queens, then you think everything else has to be easy. Little did I know that when I went to HMSA, it was like learning a foreign language to understand the insurance business. It was difficult because all of a sudden you went from the provider side to the payer side, and there's a definite chasm between the payer and provider side of healthcare. And so one of my responsibilities at HMSA as a former provider who's got pretty good relationships out in this community for healthcare was to try and bridge that chasm for HMSA so that we're not viewed just as the payer, but we're viewed as a partner in the whole health delivery ecosystem. So this is me. I graduated in '85 from JABSOM, so 40 years ago. I trained at Northwestern. I practiced on the mainland for 11 years after residency, came back for 5 years, and then I went to Philadelphia for 7 years. And you would think, once you come back, why would you ever leave again? And to be honest with you, that helps me understand why young people leave Hawaii to practice. It's because I didn't feel at the time like what was here was going to offer me enough to continue to grow my career. And so I left for 7 years. And then I came back to be the chair of the Department of Surgery. I had been on the board of directors for HMSA from 2016 until I retired and decided to work at HMSA, which for obvious reasons I needed to rotate off the board before I could work at HMSA. And it's been an interesting journey for the 21 months and 9 days at HMSA, because as I said, it's like a foreign language. Surgery, believe it or not, as I'm learning, was easy compared to working in the insurance industry. But that's my journey, and I hope to share with you some of what I've learned about Medicare, because like so many people out there, when you have to sign up for Medicare, you realize how complicated we've made our healthcare delivery system and our payer system. And the other thing as a surgeon is, it was very easy. I did surgery, I submitted a bill, and I got paid. And if I didn't get paid, it's because my documentation, my operative report wasn't good, so I made some changes, resubmitted, and I got paid. What we don't realize is that for primary care providers, internal medicine, family medicine, pediatrics, geriatric medicine, it's a very complicated world for them to get paid. They have to have quality metrics they fulfill. They have to have documentation, which is incredibly complex. And so it makes it very challenging for them to see more patients, because a lot of them are doing what we call pajama time. And what that means is that they're charting at night instead of spending time with their family. They're up till 11 or 12 o'clock at night charting instead of getting the rest they need to be good providers the next day. So it has been challenging. So HMSA started in 1938. What a lot of people don't know is it was started by social workers to make healthcare more accessible in Hawaii. And so HMSA has been around for 87 years. And one of the challenges right now, not just for HMSA, but for all healthcare payers, is how do you make sure you're sustainable for the next 87 years? Because there's challenges, as we'll talk about, coming from the government it's making it harder and harder to pay for healthcare. It's making it harder and harder for people to get the healthcare they need that's affordable and still high quality. So for HMSA, the vision is that we want a Hawaii where families and communities live ever healthier lives. Very simple, but could not be more true. I won't go to the purpose, but just know that it's really about making sure people get the care they need at the time they need and in the place they need. All right, so getting to Medicare now. It's obviously complicated. For all of you who signed up for Medicare, if you had an easy go of it, I commend you, because for me, it was a journey. I decided to retire at the end of December in 2023, actually. Maybe that's wishful thinking, 2024, but 2023. And I worked for the state for 13 years, so I qualified for EUTF, which is the union retirement. They provide the retirement benefits for state employees. And so I had heard, oh boy, you have to sign up for Medicare Part A and B before you turn 65. You have 3 months. If you delay it beyond 3 months, there's going to be a penalty. And quite honestly, I still haven't sorted through what that penalty would be or how it would be decided that I would have to pay. So being the diligent physician, I went and signed up. And I signed up in November, retired in December. And I thought, oh, I'm not going to turn 65 till the end of December, so I'm pretty sure my first bill will come in January. Well, lo and behold, it's the one thing the government's really efficient at. They sent me my first bill in the first week of December. So I was like, I'm not even 65 yet. But I had to pay that bill because the bill came and I had to, by a certain date, I had to pay it. So it was really complicated. And what I didn't realize, I called an insurance broker, I called HMSA, and finally, the way I got help was because I qualified for EUTF, which is a state retirement plan, or they provide the coverage for the retirees. I went there, and they helped me the most. They had a checklist. They told me what I needed to do, what I didn't need to do, and so as I told Kamal earlier, the one thing is I signed up for Medicare, and then I was like, I'm going to work at HMSA now. I found out, so I'll have insurance. So I'm going to cancel Medicare. Getting Medicare is hard. Canceling Medicare is twice as hard. And so I couldn't get anybody on the phone. I couldn't figure out what to do to cancel. So EUTF fortunately said, no, you have to have Part B Medicare in order to get your EUTF benefit. So I kept it, and so it worked out, but I realized then that as much as I thought I knew about medicine, I knew nothing about how to get post-retirement insurance coverage, healthcare coverage. So what is Medicare? So, it's federal insurance for people, right? And it really covers you if you're 65 or older, if you're under 65 with certain disabilities, and at any age if you have end-stage kidney disease. So if you have kidney failure and you qualify, you will be able to qualify for Medicare with that disability, or people with Lou Gehrig's disease or ALS. And so if you have those things, you qualify for Medicare, and this is your Medicare card. I have one in my wallet myself. So, but CMS is a federal agency, and it runs the Medicare program. It also runs Medicaid, the Children's Health Insurance Program, and the Health Insurance Marketplace. So they provide a lot of coverage for healthcare for Americans. And they actually cover about 160 million people in the country right now. So a significant portion of our population in the US has some coverage through CMS. And that's important because if you know what's going on with the government right now, it's a challenge because rules are changing. And so we'll talk about that a little bit, but we constantly have an eye on what the changes are going to be. And for example, you probably have heard, or you may have heard, that for Medicaid, they're changing some of the work requirements so that people can qualify. And the one thing about Medicaid, I'll just diverge for a second here, is that almost half of our children in the state of Hawaii are covered by Medicaid. And it's because of our insurance pre-coverage requirement for employers. So if you work more than 20 hours a week, your employer has to provide insurance for you. But if your salary falls less than 3 or 3.5 times below times the federal poverty level, then your children can be on Medicaid. So we have people who have insurance, but their children are on Medicaid. And so when we talk about impacting Medicaid coverage for our state, it's a significant impact, and it's going to really hit our children even greater than it will the rest of the population. So by the numbers, this is from September 2024, so about a year ago, 68 million people in this country are covered by Medicare, and that's roughly 90% of the people who are 65 and older in this country. Half of the people who are covered by Medicare are also enrolled in a Medicare Advantage or supplemental plan, and we'll talk about those a little bit. And about 80% have Part D coverage, and I'll talk about that, but that's the pharmacy medication coverage part of Medicare. In Hawaii, just over 300,000 people are covered under Medicare. Almost 54% are in some additional coverage plan like Medicare Advantage or some other Medicare supplemental plan. And over 90%, so 94% of our people over 65 are on Medicare. So what does that all mean, and what does this mean for you? So to be clear, Part A generally doesn't come with a premium, and that's what's the hospital care you would need would be covered under is Part A. It's for inpatient services when you stay in a hospital. Part B covers Medicare services like outpatient surgery, doctor's office visits, and if you lump A and B together, that's what original Medicare is. When you hear about Medicare Part C, that's actually Medicare Advantage. And those are actually plans that are administered by private insurance companies, so like HMSA, right? So we have Akamai Advantage, which is our Medicare Advantage product. And then Part D is prescription drug coverage. So the interesting thing is that there's so many permutations of this that's what makes it complicated to know what to sign up for. Suffice it to say, one thing to emphasize is in order to sign up for a Medicare Advantage plan, you have to have Medicare A and B. So you can't just go to an insurance and say, I want Medicare Advantage, your Medicare Advantage plan, if you're not enrolled in Part A and Part B. All right, so, and Medicare Advantage actually, the way it works is we have a certain number of people who have Medicare Advantage through us. So it's the same for us and any other insurer in the state or across the country. And based on that, the government figures out what's called a per member per year amount. So for each Medicare Advantage member, the government gives us a certain amount of dollars per year. And it's capped. You can't say, you know what, we actually need more, right? They set those rates. And for us, it's about making sure that we can provide the coverage our members need at or below that dollar amount. Because if it exceeds that dollar amount, then unfortunately we have to figure out how to cover those losses, and it often comes on the backs of other plans like commercial plans, and it makes it very challenging. So insurance companies across the country are actually, many of them are running in the red for Medicare Advantage plans. And the reason is the government keeps decreasing what they pay, but the cost of delivering the care keeps going up. So in 2024, for the state of Hawaii, the cost for Medicare Advantage, the cost of care for Medicare Advantage increased by 11%, and yet the payment from the federal government didn't go up 11%. So you can see that over time, you'd have this divergence, and less of what we need to cover can be covered because of that. So just a brief explanation for how we got to where we are. All right, so again, Part A is for hospital insurance, inpatient care, skilled nursing facility care, hospice care, home health care. And this is that first part of original Medicare. Part B is the other part of it. And this covers when you see your doctor or other healthcare provider, outpatient care, some home health care is covered, and durable medical equipment. These are things like wheelchairs and walkers and things you would need to help you with your activities of daily living, basically. And then some of the preventive services, and that includes things like screenings, vaccines, if we continue to cover vaccines through Medicare, and then yearly wellness visits. So it's interesting that there is a requirement from Medicare that doctors should see every member once a year for what's called an annual wellness visit. Unfortunately, many people who I talk to are like, well, I didn't see my doctor for 2 years, right? And so you can imagine what that does is, right, if you have some health issues, whether it's high blood pressure or diabetes, and you don't see your doctor for 3 years, the chances of when you do see your doctor in 3 years of you actually being better are very slim. More than likely, your health will have deteriorated some. And so that actually leads to the requirement for more care or more expensive care, because now you have a complication or you need hospitalization. And that's why those annual wellness visits are emphasized a lot in Medicare, is we want to make sure that whatever healthcare issues people have, we're actually addressing them proactively rather than reactively. All right, so Part C, the Medicare Advantage, I talked about this a fair amount already, but you have to be, as a health insurer, you have to have an approved plan, and the government basically gives that approval for you to offer plans. And every year we have to put in what's called a bid. So we put in a bid with Medicare, the health insurers do, that says this is what our benefits are going to be, this is what we want our premium to be, here's what we think we need to get paid by Medicare. And basically it's a one-way negotiation for the most part. They decide what they're going to give us, and then it's our job to figure out how to deliver those benefits with the dollars that they give us, right? So we're really sort of an intermediary. And I think the one thing we always emphasize is the dollars we spend on healthcare as insurers, it's not our money, it's your money, right? So it's our responsibility to manage those dollars the best we can. And if we can't manage them effectively, then that's when we run into deficits, and that's when we struggle. All right, so again, these bundled plans include A, B, and many of them include D, Part D, the pharmacy benefit. So as you look around for a Medicare Advantage plan, if you're going to get one, you should look at the premium, you should look at the benefits, but you should also look at things like copays, because some of them, low premium, lots of benefits, but unfortunately a higher copay, which is out-of-pocket expense for you basically, right? So those are the things to think about. You have to weigh all of the things in an insurance plan when you sign up. All right, so Part D is, again, the prescription drug coverage part of Medicare. Most or many Medicare Advantage plans provide some Medicare Part D coverage. So as you look at a Medicare Advantage plan, you should look, am I gonna get pharmacy benefits? Because if you don't, you definitely don't want to go to the pharmacy without health insurance coverage, because the bill can be enormous, right? The other thing to look at when you sign up is one drug is not the same as every other drug. So most plans tier the different medications, tier 1 through tier 5. And tier 5 are going to be the higher end drugs. So a lot of plans don't cover some of the more expensive drugs. So as you go and you look, you have to decide, what medications am I on? Am I on a really high cost immunotherapy drug? Is it covered or is it not covered, right? And so they're not all the same. All right, so what are your options? So when you enroll in Medicare, again, you should enroll when you're eligible, 3 months before the month you turn 65, the month you turn 65, and 3 months afterwards. So it's a 7-month window to sign up for Medicare. And you're going to sign up for Part A and Part B. But Part A and Part B don't provide everything you're going to need, probably, because it doesn't include drug coverage. And that's where you have to figure out, are you going to get a Medicare prescription drug plan, which is called an MAPD, or a Medicare supplemental or Medigap plan? And I'll show you a table a little bit. And I had some handouts here for you as well. Option 2 is you sign up for A and B, but you sign up for a Medicare Advantage plan. So you don't need to do all the separate things like pharmacy or Part D and a Medigap plan. You just sign up for Medicare Advantage. But if you just go online and you type Medicare Advantage plans in Hawaii, you're going to have like 12 pages on Google of things. So it's very hard to navigate that. And what you want to do is you want to compare what the premium is, what the benefits are, what the copay or co-insurance amount is going to be, and then in the medication coverage, what is covered. You also want to know, if you have a hearing aid, are hearing aids a covered benefit? If you have glasses, is vision a covered benefit? Because for most Medicare Advantage plans, some way, shape, or form, those things are covered. It's just a matter of to what degree and what the cost is going to be. So those are some of the important things to think about when you sign up. Oops. And at the bottom here on the right where it says extra benefits, that's what those extra benefits are. It's drugs plus what other things are provided for you if you sign up for a Medicare Advantage plan. All right, so this is really a busy diagram with lots of small pictures, but it basically is a schematic of what we just talked about. Signing up for A and B, and then you need a Medigap or Medicare supplemental plan and prescription in the blue. On the right, if you sign up for Medicare Advantage, generally, and you want to look at the plans, what's included and what's not. But that's what you hope to get covered in your Medicare Advantage plan. So again, the initial enrollment period, the month you turn 65, I thought turning 65 was going to be stressful and depressing, and it was most depressing because I couldn't figure out how to sign up for Medicare. Anyway, so I empathize with you if you struggled, and I sympathize with you if you're about to try and sign up. So, but it really is. But after you enroll, you'll get a welcome packet. As I said, for all the things the government seems to be bad at, they're really good at sending you the bill for Medicare. You'll get a Medicare card, and you'll get Medicare, and you'll get the handbook, right? I think the one thing to understand is if you have other coverage, so let's say your spouse has commercial insurance, is still working, and you can still be covered under their plan. The one thing I'm going to find out for Dr. Masaki is, does that 7-month window apply to you if you're still covered for commercial insurance? I believe it still does, but before I tell you for sure, I want to make sure that I don't lead you astray. So I will let Dr. Masaki know, and Masaki know and Chang, and they can give you a follow-up email about what the answer to that question is. So really, you sign up online, and they make it remarkably easy to sign up for Medicare. It's nearly impossible, as I said, to actually cancel Medicare. All right, so how is Medicare funded? And this is a very busy slide, but just know there's 2 ways Medicare is funded. The Hospital Insurance Trust Fund is really from payroll taxes that we all see when we get a paycheck, and it's Social Security or whatever it's taken out by the government. Part of that is to support Medicare Part A. And it's also supported if people pay, some people have to pay a Medicare Part A premium, and it's also supported by that. And this, again, it pays for Part A, so it pays for the hospital part of the insurance program. Part B is actually funded by the Supplementary Medical Insurance Trust Fund, and that's the funds that are authorized by Congress. So this tends to be variable depending on where Congress how much they want to support Medicare, right? But this is covered by that, plus the premiums we pay for Medicare Part B, and that's the part we actually do pay for in your premium. It pays for Part B benefits, so the office visits. It pays for if there's a Part D plan, it pays for Part D, whatever coverage you're going to get in that. And then both of those trust funds do cover the administrative costs of running the Medicare program. And what I tell people is, I showed you the numbers. We have 360,000 Medicare subscribers in the state. There's, I forget how many millions of people nationally. So you can see the scope of what Medicare has to deal with. So again, this is Medicare Part C, so Medicare Advantage, and for HMSA it's called Akamai Advantage, obviously. And this is not a sales pitch, but it's just to tell you what's included. And as an example, when you look at a Medicare Advantage plan, because this is the one I know best, obviously, this is what you're going to get. Part A, Part B, prescription drug plan, and those extra benefits again. So you want to look at those things as you sign up for a Medicare Advantage plan. This, again, is a little bit small and busy, but just know that in original Medicare and Medicare Advantage, you do have to pay the premium. There are premiums, almost for sure, co-pays, deductibles, and co-insurance. So you want to compare those things. Co-insurance, it depends. So if you have Medicare Advantage, members usually have a set dollar co-payment. So you know what you're going to pay. Whereas in traditional Medicare, it's generally 20% of the total cost of service. So if the cost is $500, it's got to be $100. If it's $50,000, it's going to be $10,000. So it's variable for traditional Medicare if that's all you have. All right, so the out-of-pocket expense, there's usually a maximum out-of-pocket when you sign up for a Medicare Advantage plan. For traditional Medicare, there's no limit to how much your out-of-pocket expense would be. All right, then prescription drugs, we talked about a lot. Supplemental benefits, I mentioned. And really, that's probably one of the biggest and most important pieces of a Medicare Advantage plan is what supplemental benefits do you need? If you don't wear glasses, if you don't have a hearing aid, and you're on no prescription medications, You may not even need Medicare Advantage, right? But if you have those things, you want to be really cautious and look at what you're going to get, how much it's going to cost. So is a hearing aid covered regardless if it's $500 or $2,000, or is it capped at $300, right? So those are the things you need to look at as you sign up for plans. As I said, we could not make this more complicated as a healthcare ecosystem, all right? So now the network of doctors, and this is actually a really important thing as you look at plans, right? So in traditional Medicare, you just have to find a doctor who accepts Medicare, and most providers do. And if they are employed, it's a requirement by most employer groups that employ docs, they have to accept Medicare. It's a requirement. So you shouldn't have trouble finding a physician. If you have a Medicare Advantage plan, you tend to have to find a doctor in the network of that Advantage plan. So the one thing, obviously HMSA covers about 65% of the lives in Hawaii. We have the broadest network. So that tends to be one of the attractions for people when they sign up, is almost for sure a doctor is going to be in the HMSA Medicare Advantage network. And it varies from provider to provider. And so it just depends. That's what you need to look at. Like if you have a doctor you've seen for 20 years and you're thinking of getting a specific Medicare Advantage plan, it's okay to say, if I sign up for this plan, can I still see you, right? And the answer is almost for sure going to be yes, but you're going to have a larger out-of-pocket expense because you are going to be out of network for that insurance plan. All right, so I'm trying to make the slide smaller and smaller so you all think you need vision coverage, but this is a comparison table, and there's a similar table that I think we provided for you. But so there's original Medicare, we talked about that at length, original Medicare plus Medigap or Medicare supplemental. There's Medicare Part C HMO plans, Medicare Part C PPO plans, and those are the Advantage plans. So they vary, but again, you should not sign up for anything in Medicare Advantage unless you read carefully about what you're going to get, and more importantly, what it's going to cost you to get what you need. And everyone's needs are different, so I just encourage you to be very cautious as you look at this. Let's see, I think I covered most of what's on this slide anyway. So again, specialty care, if you have a specialist you see, let's say you have to see a pulmonologist because you have asthma. Just need to make sure that that provider is going to be in your network if you sign up for a Medicare Advantage plan. And if they are, what's your out-of-pocket expense when you go and see a specialist? And it, again, can vary from plan to plan. All right, so this is just, I know I talked a lot about Medigap or supplemental Medicare, and this is what it is on the left and Medicare Advantage on the right. So again, the big red X's for Medicare Advantage, you are going to be limited to your network from the standpoint of what you're going to pay. You can go out of network for any insurance. It's just your copay or the payment for you becomes higher. All right, and for Medicare Advantage plans, most require some referral process. It's not like a true PPO commercial insurance where you can see a specialist without a referral. For this, most of the time you need a referral. For Medicare, for Medigap, some routine services like vision and hearing are not covered. So again, read the fine print about what is covered and think about what you need. And the good thing about it is we're in the open enrollment period now, or we're about to enter it, I guess. We just entered it. Every year you can change, right? So it's just a matter of knowing what you're getting so that you don't go a whole year and have to pay out of pocket if you don't need to. Most Medigap plans, supplemental plans, don't include pharmacy coverage, so you do have to get Part D. So that's an additional expense for sure, that under most Advantage plans, there is some pharmacy coverage. All right, so just because, again, this is the one that I know, I'm just going to go through this quickly, but so you can see what a Medicare Advantage plan might look like. And again, I'm not selling you this plan. It's a matter of your choice, right? But so all of the plans that HMSA offers benefits, and many of them are above what traditional original Medicare will offer. For 2026, our plans are going to start at $20 per month as the premium. And so the one thing is, if you have HMSA's Medicare Advantage, you may have had what's called a $0 premium plan with pretty good benefits, and that's true around the country. There are a lot of $0 plans because insurers are trying to attract people to sign up for their Medicare Advantage, right? But because of the losses from Medicare, that I kind of alluded to earlier, not just for us, but many health plans across the country, those $0 premium plans are actually going to start going away because it's not sustainable. So for 26, we're going to have a $20 a month Medicare Advantage plan. There's no co-payments for primary care provider visits and lab services. No preferred, there's $0 preferred generic drugs. No co-payments for dental cleanings, exams, x-rays, and other things. Vision benefits include $300 annually for eyeglasses and contact lenses, and $0 payment for hearing exams, and hearing aids starting at $195 per aid. And that's why I said you need to look at what you're going to get. So $195, my father-in-law got a hearing aid, and he got one that was almost $2,000. And then went to Costco, and it was $300, a different one. So it's just a matter, and that's why, unfortunately, the way the system's set up, you actually have to become an informed consumer. Otherwise, you will end up with a larger out-of-pocket expense. All right, so in our plan, you can choose your own doctor from a large network of providers. As I said, most providers accept HMSA's Medicare Advantage right now. You can get care either in person or telehealth. It's covered with HMSA online care. And really, other than that, I think many of them are going to be similar. With the HMSA plan, if you need to travel in the US, you'll be covered on the mainland and actually worldwide because of the Blue Cross Blue Shield Blue Card benefit. So again, just ask questions. I'm not telling you have to sign up for HMSA, but those are the kinds of things you want to be able to find out when you inquire about a Medicare Advantage plan. All right, so if you're not already in Medicare, if you're approaching that age, you should start planning, start thinking about what you're gonna do when you get closer to your 65th birthday. You should enroll in Part A and Part B unless you have a reason not to. And I will find out about if your spouse is employed and under a commercial plan, if you need to sign up or you can be deferred. I believe you can, but I just want to make sure before I tell you for sure that you don't have to. Let's see. So I think that's the end of it, but last year there were a fair number of questions, so I wanted to leave some time for questions. I do appreciate the chance to come and speak to you. It's, I think I spoke in the spring, and in the 6 months since the last spring, I feel like I've learned an encyclopedia worth, and I still have another encyclopedia volume to go through about what this all means. But I'm happy to answer your questions, and if I can't get it, I'll try and get you the answers.
Thank you so much, Kenric. Do we have any? Oh, I see a lot of hands already going up. And online, so we will alternate between in-person and online. Online, please type your questions into the chat.
Yep. This one? Oh, yeah. So the handout came from spring, but things changed between spring and now. So I think we have the updated, and I think, Chang, can we send those out electronically, the new slides? We'll send out the new slide deck electronically.
So
it did change.
after the changes, do we have or don't have this $200 every quarter for over-the-counter health products? That's what's on here.
I'll have to look and see what our current benefits are. I will say that our premium used to be 0. Now it's going to be 20. And for the most part, the benefits did not change. But I'll find out about that one.
So would that include supplements?
Generally, supplements are not covered. It's prescription drugs primarily.
I see. No, the over-the-counter.
Over-the-counter, I think it still has to be medication, over-the-counter medication. I don't believe so. Vitamins, I have to check to see.
Okay.
I pay for my own vitamins, so I'm not sure. I'm sorry.
Thank you.
It's amazing the questions that I get. It actually makes me go back and learn even more.
Thank you so much
Yes.
for this presentation. I have 2 questions. The first is, in your secret store of information, do you happen to know what's going to happen to Medicare?
That is a really good question. So as I said, we watch this every day,
Yeah.
right? Because things seem to change every day. I think the biggest focus right now is what's happening to Medicaid, but it's clear that for Medicare, we're not sure if it's going to, the money that the government pays is going to stay the same or if it's going to decrease. I have doubts that it will increase substantially, right? But I think it remains to be seen. So for traditional Medicare, those benefits are covered directly through through Medicare. So if you have Medicare, you're going to get a bill from them, and they're going to pay your claim, right? If it's not covered, you're going to have that copay or coinsurance payment. If it's through a Medicare Advantage plan, the insurer actually we're sort of the middleman in this. The government gives us the money to provide all the benefits we say we're going to provide for that money. And if we overshoot, then we lose money. And if we undershoot, well, if we overshoot, we say we're going to cover too much, then we lose money. And again, it's not our money, right? We're going to have to figure out how to provide that coverage with the premium dollars that we get from everyone. And if we undershoot, then there will be a surplus, but that surplus we don't keep. That surplus should be reinvested into the member benefits. So if this year we have a surplus, next year we increase the benefits. I don't know if that answers your question, but I don't know what's going to happen. Medicaid is a big risk right now.
Right. My second question is, we have a federal government health plan for non-A and B, and recently they convinced us to take Aetna Medicare Advantage, which I thought was only for prescription drugs. Is that possible, that they offer it for only prescription, Part D?
So there are some Medicare Advantage plans that are specifically pharmacy, so you'll have to look and see what else you get in that that Aetna Advantage plan.
Okay.
And you should get a guidebook, right? And you should see what's covered. It may be that what you signed up for, because of what the federal government does, is you signed up just for the pharmacy piece of their health coverage
right.
plan. And so that would change your premium, right? It would just be for the pharmacy piece.
Okay,
But you
thank
should find out what you actually signed up for.
Yeah,
And
well,
again,
I thought we signed up for Part D, vision and dental.
yes, so that's the supplemental coverage in a Medicare Advantage plan beyond the routine medical care.
Okay, thank you.
So I have a couple of questions.
Yes.
One of them is, we see on TV now a lot of advertisement for people who want to talk to you about various kinds of insurance coverage, and it looks like they're private organizations that are wanting to counsel people about what you're doing for us today. Can you talk about that? And then a second question that I have is, I heard, and I don't know if it's true or not, that Medicare is now cutting out telehealth. And could you talk about that as well?
Sure. So that one I'll tell you. So Medicare is leaving it up to the insurance plan about telehealth, but they're not going to. We're still covering telehealth, but Medicare is not going to cover telehealth. But for us, it's an important benefit. If you think about our geography as an island state, telehealth is really critical to us being able to provide care without people having to get on an airplane. And so we are still going to maintain our telehealth coverage. And as I said, we have an online care that also helps facilitate for people who can't get to the doctor right away and want to see somebody. So telehealth, yes. And the first question was about, so this is the open enrollment period. I think it's October 15th to December 15th or something. And so there's a lot of advertising out there. If you're like me, your mailbox every day has something from a different insurance provider who wants you to sign up for their Advantage plan. It's a little disturbing. They know I'm 65 or older than 65, but I didn't get any before I turned 65. But what I'll tell you is this. This is, as I emphasized several times, you have to do your homework. Figure out what you need, and when you talk to, they're called insurance brokers. They actually they represent multiple insurance companies very often, and they talk to you and figure out what plan would fit best for your needs. So they can be helpful, but you also have to realize that they work on a commission. And the commission from different insurance companies might be a little bit different. So if this company pays you this much, this company pays you this much, the likelihood is you're going to push this product, right? And that sounds very sort of critical, but it's not. They provide a great service. It's just you have to be your own advocate and know what you need and what you're getting for what you're paying. And again, the hidden costs are the co-insurance, the co-payment, and the out-of-pocket expense. So it sounds good if I say you have hearing coverage, but if I cap it at $100 and hearing aids cost over $500, you're still going to have a large expense, right? So it's those things. You have to actually. I wish I could tell you that there's someplace you go and you plug everything in and it spits out the best plan for you. Unfortunately, it's not true.
Dr. Murayama, my question is with regards to the Affordable Care Act. As you know, there's a lot of, how should I put it, controversy as to how it's going to impact people on ACA. So my question is, how would it impact Medicare in terms of the premiums, especially if the current proposal is to increase the premiums?
Yeah, so I would say this is, it's very complicated. Are there any politicians in here or retired politicians? Okay, it's very complicated. And that's what makes it really challenging. Not just if you're, part of the public that's out there trying to figure out what to do. Even in the business, it's really complicated because the rules seem to change. I would say this, is that with the rising cost of care that is increasingly uncontrollable, everybody's trying to figure out how to pay for health care and not diminish the services that we can deliver. And by we, I don't mean HMSA, I mean healthcare in general, whether it's the health systems, whether it's the government, whether it's the payers, the health insurance companies. So whatever happens with ACA, it's almost certain that it's not going to be a whole bucket of money is going to go in there and decrease your premium and increase the benefits you get. It's going to be probably trying to refine what is done to try and maximize what we can deliver in an affordable way. And I tell people it's unfortunately complicated, but it's based on simple economics. There's only a certain amount of money, and there's only a certain amount you can pay for. And if the money doesn't actually account for everything you can pay for, that's where we run these deficits. If we have enough money to cover what we're supposed to cover, that's when we can reinvest in the healthcare delivery systems. And so I can't tell you what's going to happen with ACA. Unfortunately, I don't even think we're going to know in 6 months what's going to happen to ACA, right? So it just depends. We're coming up on, and midterm elections are coming up, so it just depends how everything settles out with the elections, I think, also. That's a very political answer, isn't it? I said a lot, but didn't tell you much. Sorry about that.
Just another question.
Yes.
How does one find out ahead of time if their particular plan covers a medication that they're on? And if they're seeing their doctor and the doctor wants to prescribe a medicine that's not in their formulary, how do they request an exception to the formulary?
So exceptions to the formulary are challenging. And the only reason I say that is because the cost of medications, one of the biggest expenses in your healthcare, for your biggest percentages out of your healthcare dollar is actually pharmaceuticals. It's drugs, right? And it might not be you specifically that's using expensive drugs, but in general, drugs are roughly 25% of every healthcare dollar, right? And so your healthcare dollar, you might be spending 3%, but just all the other things out there are driving up the cost, right? So the best thing you can do is when you see your doctor and he or she says, hey, I'm going to put you on this new anti-inflammatory for your arthritis or whatever, you should say, is this going to be covered by my health plan? And if the answer is no, there are often other similar drugs that would be covered. Now, if they put you on that drug that's similar and it doesn't work and you need the more expensive drug that's not covered, that's when, so everybody wants to think you have to call the insurance company yourself to ask for an exception. Your doctor's going to have to provide that documentation and ask for the exception, basically, right? And that's where we struggle is doctors are so, as I said, they're so busy doing all the things they need to do that we make them do, not HMSA, but in general, that I think it's hard for doctors to like take the time to get on that phone one-on-one and say, here's why I need this exception to this formulary rule. So, but again, if you're going to be put on a drug that's new and it's not generic, that's the one. If it's not generic, you need to find out, is it covered or not? Generic drugs in general are covered.
So then would the person need to switch doctors?
First, you want to make sure that they're in your network if you have Medicare Advantage. And then if you're going to switch doctors, you know, I always tell people that one of the biggest benefits I've had from being a physician is my whole family and my whole circle of friends, I get to be their triage doctor. They call me and ask me, can you help me get to see a doctor? But so I think if you're going to switch doctors, you want to know if they're in your network, and you should go online and check and find out. Ask people who you know see that doctor. Like, do you like this person? Do they respond to your phone calls or your electronic, you know, message that you send to them? I think there's nothing more frustrating for patients than they know they need to talk to somebody and they can't get a hold of anybody, right? And we know that. I know that myself, right? And so I think it's really important that you find those things out. You can go online. There's health grades. There's all these grading systems for doctors. The only thing I will tell you about those is they tend to be a little biased because people who are happy tend not to fill those out. Right? It's only people that are unhappy that will fill them out in general, or more often. So you just have to keep them. The system we've created is incredibly complex and challenging.
I have a question from
Yes.
the online. I have Medicare. When I signed up for the Part A and Part B, I had a penalty of almost $500 a month due to my previous income tax. I'm a retired federal employee. I stopped my Part B and kept my Fed. I had a hard time finding somebody to talk to about this.
Yeah, I can feel your pain. So as I said, I tried to cancel Medicare because I thought, oh, I'm going to have commercial insurance working at HMSA, and I'm getting HMSA. So, but when I tried to cancel it, I looked online, and there was nowhere to do an online chat with someone. It said I had to call this number, and when I called that number, it said they told me if I want to cancel, I have to make an appointment, go down to the Social Security office, and I have to meet with a counselor so that they can advise me whether I should and can cancel or not. And I thought, I have to figure out, is it really what I need to do? Because they said, expect to be here for 3 hours. And I thought, oh my God. So that's when I went to EUTF. And they happened to, you know, provide good advice, and they had a checklist, and I was fortunate because I could go to EUTF. But if you have access to someone who's a non-government advisor, I think that's probably, I would start there, because, you know, the government doesn't make it easy to cancel. So I would say if you have B and you've canceled, you just have to think, I don't know why the penalty was there. I don't know if they signed up after they turned 65 or the 3 months afterwards. But there will be a penalty if you sign up beyond that time. So I will find out if you're covered, do you need to sign up?
Okay, thank you so much. I think we are out of time. Sorry, I know there's a lot of questions, and I think Chang got a couple too, but we are out of time. Thank you so much, Kenric, for trying to unravel this maze for us.
Thank you all very much.